Well, welcome back. Today we're exploring Oncolytics Biotech with favorable data on masking cancer and unleashing the power of the immune system to fight it. And joining the discuss to give us a high-level overview of their pipeline, milestones, a little bit of his history with the company, Jared Kelly, the CEO. First and foremost, welcome, sir.
Thank you. Good to be here.
Yeah, pleasure to get you on. And I wouldn't mind diving into this for newer audiences. Maybe just give us a high-level overview of your pipeline, lead candidates. Tell us what's going on under the hood there.
Yeah, absolutely. Look, Oncolytics Biotech is very fortunate. We have one product candidate. It's called Rep, and we call it Pella for short. Pella is a double-stranded RNA immunotherapeutic agent. And what it does is it turns cold tumors hot. Cancer likes to mask itself and tell the immune system, hey, don't attack me. I'm a cancer cell. I'm good. Don't attack me. What Pella does is it selectively infects cancer cells through pathways, including the RAS pathway, which is important because RAS mutations are in many different forms of cancer. And what Pella does is it tells the immune system, "Hey, attack me now, attack the cell. The immune system, come kill me." And so it unmasks cancer in that way.
Yeah, and I know your phase trials are kind of moving forward, so maybe give us an idea of what's going on recently and where the company is for milestone expectations in the latter half of the year investors can focus on.
Pella has been developed in over 20 different studies, and the company's focused on many different cancers, from lung cancer to breast cancer to glioblastoma, and most importantly to what we're doing now, uh, different gastrointestinal tumors. And so what we're focusing our development strategy, pipeline, resources, and dollars are on three gastrointestinal tumors where we have data, clinical data in humans, over 300 patients worth, that's better than the current standard of care. And it's important because immunotherapies never really worked that well in gastrointestinal tumors. And we have colorectal cancer, where in the KRAS mutant subset, we have, when you add Pella, you get almost 2.5 times to 3 times survival benefit. And we have an anal cancer, where immunotherapy's only recently been discovered to work well. We still do 3 times better than this current standard of care immunotherapy when we add Pella. And importantly, again, in pancreatic cancer, the crown jewel of our portfolio for now, we show a 2 to 2.5 times 2-year survival benefit when you add Pella to chemotherapy, which is standard of care. So we're developing those three things in our pipeline. We're moving them forward simultaneously through the regulatory process, and the regulatory process can take a lot of time. And I know there's a lot of impatience, and me specifically, very impatient. But once you submit a meeting request, for example, it takes 75 days just to get back on the calendar. So we're moving those through as fast as we can, focusing on registration-enabled studies, not on proof of concept. We've already proved this drug candidate really works well in these three tumors.
Yeah, absolutely. And I appreciate the insight. And I wouldn't mind rolling back a bit into your history as well. I mean, you've got quite an experienced background in corporate law, specifically within biotech, and involvement in multi-billion-dollar deals with mega caps like J&J. What kind of led up to that aha moment? How did you get involved with Oncolytics?
Yeah. Thanks for asking. I've done 50 to 100 different transactions in the space, anything from licensing agreements to big buyouts like the Ambrex buyout. What got me involved in Oncolytics? It just reminded me so much of Ambrex. It was a 15 to 20-year-old company, proven out science, just a little bit overlooked, strong efficacy, but just didn't have the right team leading it through to really take advantage of the commercial opportunity that the drug candidate has. And so just like Ambrex, we coming in, taking a fresh look at it, highlighting the very important, sort of what I call game-changing data in the GI tumors. And we're going to be interacting with regulators and with pharma partners to push this forward as soon as we can.
On that note, we'll pass it off to the viewers as always. Consider subscribing. News Catalyst comes down the wire. We're going to bring it to you here. But on that, we look forward to catching you in the next one.